the role of homeopathic medicines, homeopathics, in the management of brain cancer. So the big question mark. Hi there, my name is Dr. Walter Lemo. I'm a naturopathic physician with a practice solely focused in cancer care for over 20 years. So I was reminded about a research paper that was published back in 2003, and where there was some investigative work looking at two homeopathic medicines called Ruta 6C and calcare-phosphoricum 3X, so CalcPhos 3X. And there was like a genuine interest just to see what these couple of homeopathic medicines could do in some brain cancer cases. I think it was sparked from because there was a family line of doctors from India that were claiming some successes with brain cancers. And so there was just some more genuine interest to see what these could do in a very small sample size. And then what they also did, though, is they did some laboratory analysis in the laboratory to see what these homeopathic medicines could do. And where was that work done? That was done at MD Anderson down in Texas. So they're considered a very prominent cancer center in the United States, and they are considered the elephant in the room, so to speak. And what they found was that they had a series of about 15 patients with different kinds of brain cancers. And what they noticed is that the patients who had gliomas, so a certain type of brain cancers, so 6 out of 7 patients of these glioma patients, they showed complete regression of tumors. So very strong statement. And these patients were considered more of the worst of the worst in terms of their staging of this diseases. So the diagnosis I'm just reading on here were based on radiology, so CT scans and clinical management. So and in terms of, this was done in India, like the clinical use. So most of these cases were at advanced stage of the disease when homeopathic treatment was started in India. The patients gradually improved as indicated by CT scans and clinical findings. The major complaints before treatment were headache, problem with vision, paralysis, seizures, vomiting, weakness in the extremities, loss of memory, numbness, insomnia, and loss of taste. The age range was from 10 to 65 years, and the time required for a cure or symptom-free state or static condition, so meaning stable disease, was 3 months to 7 years. So, and then what they did further, so that was the clinical work was done in India, but in the laboratory, they wanted to see what these homeopathic medicines could do in the laboratory with these cancer glioma cell lines. And guess what they found? They found that it actually had anti-cancer properties in the laboratory. And they were trying to explain how these homeopathic medicines, which is considered very dilute by conventional standards, could do something like this. So anyways, so while we do not understand how something could work, and that includes myself being a naturopathic doctor as well in this area, here they reported some findings in humans, yes, small sample size, and then in the laboratory they also noticed some findings under more strict criteria, and where the work was done at MD Anderson in Texas, of all places, right? So anyways, I just wanted to, and what's so sad or unfortunate is that work was published in 2003, and here we are in 2025. So 22 years later, and this work has never been repeated again. So I know if this was some fancy drug with a fancy patent, people all over the world would be looking at this, but because it's homeopathic, it's considered very cheap, really low risk. Anyone can potentially make this in their backyard. The work has never been repeated again. So, and what's unfortunate is that there's also various countries of the world where, homeopathic medicine is quite dominant. Like look at India as an example. It's massive there. In parts of Europe, it's big there. Like I remember my wife was once taking this course from Italy. It was a federally sponsored document. And there was some discussions on homeopathy in this in this book, and she says, you know, Walter, like this is like being presented as if this is an accepted form of like a respected form of treatment in Italy, you know, and that's how it was presented in this federally, you know, stamped document. So, anyways, I just wanted to bring some attention to this area, and that hopefully more research could be done again, and just to see what is possible with some low risk, you know, treatment. You know, the brain cancers management are tricky. There's not a lot of room in that brain when there's cancer in there. The skull doesn't expand, and that's why it causes such very quick and drastic changes to people. Unlike when it's below the neck, you know, the liver could stretch, the lung could stretch, but the brain can't because it's encapsulated in the skull. And so here we have these very two low risk homeopathic medicines that showed some promise in some glioma patients. Yes, it was done, that work was done in India independently, but yet in the laboratory it was showing some interest as well and never repeated again since 2003. So hopefully some more work could be done to explore some interest in this area.